one of them is not controlled, it's going to affect on the others, and it's going to, make controlling asthma much difficult. And this one was confirmed as well with a very big group, SARB-3 in the United States, that showed that people with sinusitis that have higher risk of exacerbation compared to people without sinusitis. We're talking about 4 times higher than people without anything, but with people without sinusitis, we're talking about 2 times higher. Now, where it comes the targeted therapy or biologic, where it comes when you talk about GINA guidelines, as Dr. Riyad mentioned briefly in his presentation, once we have a patient who was on step 4 and we have to go to step 5 after we made sure that patients its diagnosis is correct, underlying comorbidity is correct, and patient using their medication appropriately, and their asthma is not controlled, then we have to classify them. We'll have to find their endotypes, either allergic or eosinophilic. Do they take oral systemic steroid or not? Once we classify that, then we have options. Now, we are lucky living in an era that we have an options that we can provide to our patient without giving steroid, or even to take them off the steroid, because all we know the side effects of steroid and the comorbidities comes from the steroid. And we have in the market now, we have the anti-IgE, we have the anti-IL-5, our anti-IL-5 receptors, or we have anti-IL-5, IL-4 receptor antagonists. All of them, they have their own characteristic, own criteria to choose within. But once you have those criteria built in and you know which one to pick, I think this is very important. Once you have a patient on high ICS/LABA or ICS/LABA plus LAMA, then you have to consider those biologics to prevent further exacerbations and to improve quality of life of those patients and prevent chronic damages or irreversible damages. So now let's talk about a real life patient that I do have and I've been dealing with, and I will show you how we can handle those patients when you have it in your clinic. And this is, by the way, this is a regular patient. You will see it in your clinic, I should say, on almost every day. So we have a 32-year-old female, non-smoker. She has been having asthma since childhood, and it's persistent. Along with her asthma, she has sinus striates with the nasal polyps and sensitivity to aspirin. Her asthma polyps, it's very persistent. She had multiple surgeries. She had 3 times FIS. Despite that, it comes right back within months. Her main problems when I start seeing her, exertional dyspnea and wheezing basically at baseline. She was on SABA, I should say, on daily basis. Despite she's using ICS-LABA, high-dose ICS-LABA, LAMA, and